an aspect of a musculoskeletal assessment that can be done pre-operatively. Knowing that the patient is likely to be in pain immediately post-op, and there would be a need for them to start off with some certain basic exercises immediately post the surgery, you will teach them only those many exercises as are necessary. Okay, this will help them understand that exercise better because they'll be in less pain right now. And so I'm not talking about the arthritic pain that compelled them to take the surgery, undertake that surgery, but I'm talking about the pain which will be associated with the exercise. So they will be teaching, they will be learning it in a when they are in a better form, and then it becomes easier for you to start then immediately post the surgery. So only those 3-4 exercises which need to be taught to the patient immediately on the day of surgery, they can be taught to them pre-operatively. Then I already mentioned about home modification. That is the major reason why the therapist is made to visit home. So it could be simple things that can be made to change, like increasing the height of the bed, so adding up a mattress, or maybe elevating it with the help of blocks, or identifying the chair that the patient uses, then the material that the sofas are made up of, if they are too soft, too firm, um, if they are too soft especially, even if they are of the appropriate height, it may not be suitable because the patient would sink into it. And that's why with all this, it needs to be some modifications may be necessary. Likewise, other modifications that are usually necessary are those in the toilet, because if there are Indian style toilets, then in that case most patients are not permitted, no patient is permitted to use it after the surgery for an extended period of time. And that is why the elevated toilet chair should be used. So depending upon what is the extent to which modifications can be made, the extent to which they are financially feasible, the therapist needs to identify those and bring about suitable options for the same. Okay, so the appropriate home modifications need to be advised. So it could be simply, if there are thresholds, those may need to be removed for some patients, especially the more older ones who are likely to use walkers for an extended period of time. Okay, it could be maneuvering the walker into the toilet area, which may not be permitted because of the width of the doors and so on. Okay, so of course civil changes may not always be possible, and those the architectures are such that they allow for all these, but some necessary modifications can be still identified and suggested. Okay, simple things like grab bars being attached, or if there are staircases, and if it is feasible, then in that case, to some extent, if they can attach some handles onto which the patient can hold on to, becomes necessary. Okay, another very important aspect of this preoperative therapy is getting familiar to the patient, and the patient getting familiar to you. So if you are going to be the therapist approaching them even post the surgery, it helps if this rapport is built up previously. Okay, so they have better confidence in you, they can share their concerns to a better extent, and that will also has been found out to aid recovery post the surgery, apart from these other obvious factors. Okay, so the therapy actually starts pre-operatively and not post-operatively, and these would be the some of the factors that would be included in the same. Okay, come to the post-operative management. So the patient has got operated, and the first and foremost that we want to do is prevention of complications. Okay, we have already talked about some complications that are likely, in which we had talked about infective, which is not really in our scope to prevent, and it is not in our scope to even treat. So leave that aside. Then comes the respiratory complications. These become more relevant when the patient, because all of them are mostly they are elderly patients. Okay, so the most common reason for having to undergo a surgery, a hip replacement, is osteoarthritis, be it the hip or at the knee. The other causes, like we have mentioned in here, RA and SPON, they contribute to a lesser extent. Okay, but the majority, the chunk comes from osteoarthritis. So we are looking at elderly patients, and that is why you know that there is a decline in the pulmonary system that takes place as a part of aging. Okay, some of them may be asthmatic, they may be on some drug therapy already. So all you will have identified already preoperatively, right? So especially in this vulnerable population where the effects of